right, Miss Harris, your chemo's all done, and we're going to take out your IV line. Before I do, I need to place your pegfilgrastim or Neulasta injector. This is going to go on the back of your arm, and since you're right-handed, I thought it would be a good idea to use your left arm. Is that okay with you? Great. And I do know that Dr. Moss discussed this with you today, but there are a few things that I would like to go over with you since this is the first time you're going to receive this medication. Pegfilgrastim, or Neulasta, is given to help your body recover from chemo. It stimulates your body to make more white blood cells, specifically neutrophils, which are important immune cells that fight infections caused by bacteria, viruses, or fungus. When you receive chemo, it lowers your immunity and you're going to be more susceptible to infections. When we give you this medication, it's hopefully going to prevent any infection from happening. So this does not replace hand washing or wearing your mask, but this will help to protect you. Also, we want to make sure that you're limiting contact with people. We already talked about that. So the on-body injector delivers Neulasta under the skin, and I will give you some more information to take home with you that you can read about that. The pre-filled syringe with the Neulasta is part of the Neulasta Onpro kit. This is going to go directly under your skin, the injection, and the Onpro kit goes on your skin with an adhesive backing. There's going to be a sensor and it will have lights and sounds that will let you know the status of your injection. You should not receive your dose of Neulasta any sooner than 24 hours after you finish receiving chemotherapy. So we set yours up for 27 hours, and that is going to be on your arm. Tomorrow at 4 is when it should go into your arm. Is your husband going to be home then? Excellent, because I want him to make sure that the injection delivery and you're receiving it, which takes about 45 minutes, goes smoothly. And I want him to stay with you for an hour after the injection in case you have a reaction. Now, there are some reactions that we are very concerned about, and those are things like injection site pain or redness that is severe. So if that happens, all your husband has to do is grab the edge of that adhesive pad and peel the injector off. And another one is if you have pain in your upper left abdomen or left shoulder. This could be a serious problem with your spleen. And if that happens, we want you to give us a call immediately. And also, if you have any trouble breathing, your face or ankles swell, you have blood in your urine or dark urine, and you're urinating less than normal, you're going to give us a call. Well, now that I've scared you half to death, let me tell you that these things are very rare reactions, so don't panic. If something happens, we're going to take care of it. The most common reaction that our patients have is bone pain. It usually peaks about 3 days after they get this injection. You can take an NSAID like ibuprofen or naproxen, 500 milligrams twice a day. This is what our patients tell us that is the most effective for them. Now, if that does not relieve your pain, please do not suffer in silence. We want you to call us and we'll talk to Dr. Moss and we will find a solution. You can do just about anything with this injector on. You can shower, you can wear clothing. Just make sure that when you are showering that you don't get soap or lotion on it because it can loosen the adhesive. And you shouldn't take a tub bath or get in the hot tub or the sauna because it could change the medication that is in the injector. Now, I know it's probably too cold for you to go out and do some sunbathing, but we don't recommend that either. And try not to lie directly on it when you are in bed because it could affect how the injector works. We need you to keep it away from electrical appliances, 4 inches, just 4 inches, microwaves, telephones, TV, things like that. And then when the injection is done, you can take it off. You should hear a long beep or the status light should be solid green or it should be off. You probably want to have your husband do it because it'll be easier for him to get it. So like I said, just grasp the edge of the adhesive pad and slowly peel it away from the skin. After you remove it, please inspect the device for any sign of leakage or if the adhesive is wet, because that means that something's gone wrong and it may indicate that you did not receive a full dose. You may need another dose. If this happens, just call us. If everything looks okay, Great. Just put it in a Ziploc bag and bring it back to us so we can dispose of it safely for you. So to recap, what will you do if you have swelling in your face, trouble breathing, pain at the injection site, bloody or dark urine, or pain in your left abdomen or shoulder? Right, you're going to call us immediately. And if you do have that bone pain we talked about, you're going to take 500 milligrams of naproxen or ibuprofen. And if it doesn't relieve it, we're going to get in touch with Dr. Moss, who's going to find another solution for you. All right, so do you have any questions? Oh, all right, great. So I have the packet with the paper for you to put on your fridge. Very important numbers to call if you need us. And I am going to call you in 3 days. This should be when you're going to start feeling the bone pain to check on you and make sure that everything is okay. If you have any questions between now and then, just make sure that you write them down and I will go over them when I give you a call. All right? Great. So you guys have a great day. Be careful going home and I'll talk to you in a few days. Okay? Thanks. Bye.